Good morning. Today we'll be focusing on women's health, and we have two very exciting female doctors with us. Thank you, Dr. Iwuji and Dr. Kwenin, for coming on the program. It's a pleasure to have you here with us.
Thank you. It's a pleasure to be here.
Thank you for having us.
Thank you. Dr. Kwenin, if we can just start off with you. You're a general practitioner, and we want to talk about women and women's health. For me, the issue of women's health is very important because as women, what we tend to do is we tend to look after others. We look after our families, our husbands, our children, and a lot of women tend to neglect themselves when it comes to looking after their health. They put themselves last. And for me, I'd actually wanted to change that, to actually turn the whole thing around, because I think that if you are well, if you are healthy, that actually makes you a better mother, a better wife, and better able to carry out your own responsibilities, whether at work or at home. And so I don't know what you think about that and what you see and find in women, about women in your practice.
Absolutely. Yeah, thank you for that. You're absolutely right. Women are very much about everybody else. They're about the children, especially, they're about the husband. I have women that bring their husbands to me. Meanwhile, they haven't had their checkup, but they're policing the husband, they're policing the kids all the time. So I always remind them that, what about you? So you're absolutely right. Women tend to be about the doing for others, but they don't remember themselves. And absolutely, you can't help others until you help yourself. If you're not healthy, how can you actually help others? So absolutely, you're very right in that. We see that a lot. There are a few women that, are aware and will always come, but they tend to be in the minority, actually. Most times you see women, it's either they're mostly with their kids, actually. And some of them will match their husband. My husband needs a checkup.
And it's very interesting, but we don't have a culture yet here in Nigeria of prevention. We are very much about sick care. Wait until you get sick before you come in. And I feel that if women perhaps understood this more, perhaps it'd be something that we could turn around and get people to focus more on keeping well rather than waiting until they get sick to see a doctor. Which is right now, everybody thinks, oh gosh, go and see a doctor, it's expensive, it's time wasting. But I don't know what you think we can do to change that paradigm.
Yes, you're making a good point there. I think it's very tricky in this country because there's no system set up that will invite women to go and have their screening. Even, adults in general. I know overseas they have systems set up. By the time you reach a certain age, you're invited by your GP, whether or not you're unhealthy. So when you hit 50, you're invited to come in for a general checkup, check your blood pressure and all of those things. And of course, they have all the screening programs. As a general practitioner, what we really do is all about preventative medicine. So a lot of our work is actually centered around screening, screening for lots of things. And in women, what we tend to screen for are the cervical screening and, of course, breast screening. Cervical screening, women run away a lot from it because of the process, probably, it's slightly
it's invasive
examination. Yeah. And so they're just like, no, I don't need that. Even if they do it once, you won't see them again for years. So, if we had a system set up whereby women are reminded that actually this thing is very important, then I think they would come for it. They would be more likely to come for it. And again, if they have a doctor that they're talking to that advises them. So I'm very opportunistic when I see patients. They may come in for something else and I will throw it in there. Have you had your cervical screening? And some will be like, what's that? And you're thinking, how come you don't know what cervical screening is? But we live in a country that is very possible. So it's an opportunity for me that I always take to educate the patient, and they're like, okay, I'd like to have that done. And by the time you explain it and you break it down, they find out that actually it wasn't so bad, but the important thing, of course, is the follow-up, and it's not a one-off thing. It's something that women should get done regularly.
Can I jump in here as well, please? Because when we're talking about the prevention in cervical cancer, we have the screening, but we also have the vaccines. as well, which can help with prevention. And so as we're talking about how, mothers, women are very proactive in looking after their families, it's something that they should be aware of as well for their children, because these vaccines actually start for children from an earlier age. So it's a way that you can sort of kill two birds with one stone. As you're roping in the mother to help her children with the vaccination, which will help with their health, we can also help some of these mothers get the smear test done and maybe get some of their own vaccines as well.
That's actually a very interesting angle, because they are coming in for their children and explaining to them the dangers of cervical cancer around their children, they will surely listen to. And understanding that and accepting that there's a vaccine that can help, certainly for those mothers who will be vaccinating their children, they should also be prepared to do a pap smear. I think, or at least cervical screening, whether it's liquid-based cytology, pap smear, whatever form that it takes. I think these things are interesting and perhaps could be pushed further. I know you do vaccination in your clinic, don't you, Dr. Kwenin?
Yes, we do. So there's it's called the HPV vaccine, but actually there are different types. Cervarix has been popular over the years, although Cervarix is gradually fading out. And the main reason for that is Cervarix covers just two types of HPV. So I'll talk a little bit about HPV. HPV is the virus that is been associated with majority of the cervical cancers, and there's particular types. There's several types actually, but the four main ones that we worry about when we talk about screening. So two of them are linked to cervical cancer and two are actually linked to genital warts, which, doesn't have anything to do with cancer, but it's actually also very important. And the reason I bring it in is because even though the vaccine is offered to boys as well, not just girls, because boys can actually catch genital warts when they're older, which they can then pass on the virus to the women. So we actually advocate that both boys and girls are screened at our clinic. And screening can start from as young as 9 years old, actually 9 years old to 14 years old. The vaccine comes as either 2 shots or 3 shots. As I said, Cervarix is one of the older ones. The newer ones we see more now is the Gardasil and the Gardasil 9. Gardasil 9, from its name, covers actually 9 types of the virus, whereas Gardasil covers 4 types. So if you can get the Gardasil, that's probably a great option. Gardasil 9, if available, is also very good.
I think that's interesting to know. I think what is interesting to know is that both boys and girls ideally should be vaccinated, because when my daughter was getting vaccinated, that was a while ago, there was only girls that they were vaccinating at the time. But as you know, things move on, and it's so important to move with the times, and do things that are current. And I think also one of the reasons why the other vaccines, I think it's important to get the vaccine that does as much as possible, is that we know there's so many different kinds of HPV, and you don't really know, which one is the predominant one or the one that's here or there, and it's better to be covered for more rather than less. And that proven efficacy is something that people are doing the vaccine now for their children, but a lot of women also still ask for it for themselves. So can you tell us, at what stage is the vaccine useful for women? And, just if you can give us sort of an overview on, I don't know if, also, I know Dr. Iwuji is an oncologist, and perhaps we want to also jump in here. But when is it that we use the vaccine in women?
Okay,
As in, some people advocate for it in women who've already had sex. Is it for people who haven't had sex? Is it for people who've had sex? And before you give the vaccine, before you do it on the women who have had sex, should you be doing an HPV test? And I want you to just be holistic about it, because also, when should you do the HPV? Some people say you do it along with the pap smear. Do we need to do it in this country? How far should we go?
Okay, that's a very good question. So the vaccine was originally made, if you like, for children, actually. The studies were done in children, it was made for children, And the idea behind it is that you vaccinate the children before they're exposed to HPV. HPV is transmitted through sex. It's not like an STD like we know it. It's just transmitted that way. What we also do know is that women clear HPV very easily. Some women can clear it. So you can have HPV this time when you go for an examination, and 6 months later, the HPV is gone, depending on the type of HPV. So women can clear it easily, but they can also harbor it. So in some women, they don't clear the HPV, and the HPV can stay for years. And if you then get the particular types that are associated with cervical cancer, that's where the risk comes in, which is why they then advocate to have the vaccine. So even though the vaccine was made for children, more and more women are asking for it because they realize it's a preventative thing. Can I have the vaccine? So a conversation always has to happen with the patient that yes, the vaccine you could have, it's not licensed in women, it wasn't made for women, but a lot of women have had it and they've not had issues. It's giving, I think, up to the age of 21, I believe. 21 in some countries. In the UK, I believe that age is 14. So young women can have it. However, if as an adult woman who obviously has most likely is already sexually active, what I advise is you need to be tested for HPV first. Because if you already have HPV, a particular type, then there's no point actually having the vaccine. If you're HPV negative, then the vaccine can be offered to you, but you have to make sure you get the full course. So as I said, that for the Gardasil or the Gardasil 9 is usually 2 shots. If you're immunocompromised or you have HIV, then it's 3 shots. We're advocating for these ones over cervix because cervix doesn't cover for cervical warts. I mean, genital warts. So I tend to advise women now to go for the Gardasil rather than the cervix. And Gardasil is very readily available.
Yeah. And I think also, sorry to interrupt.
Please do.
I think, so I was just going to say that with the other thing about the Gardasil versus the Cervarix is that generally the data shows, or at least the recommendations say that Cervarix is best for women up to the age of, you were saying 20, in their 20s, so 26 is what I'm used to. Then whereas the Gardasil can go up to age 45. So actually for ladies who are a bit older who want to have the vaccine, Gardasil is better because it's recommended for that older age group up to the age of 45. And exactly like Dr. Kwenin was saying, the HPV infection, we all have it throughout our lives, actually. About 80% of the population will be getting HPV infections up and down, but they're just getting it and clearing it, getting it and clearing it. It's only when you have it chronically. So actually, they say that even though ladies start having their smear test in their 20s, so about age 21, when you start getting a bit older, so when you're about in your 30s, so from age 30 to 65, they recommend that you should have the HPV test at the same time as having your smear tests. So if you have those two together at that time, then that gives you a more, a clearer screening when you're going for your smear tests. And then, as Dr. Kwenin said, if you have your HPV test and you're negative, then you can also, at that older age, go ahead and have the vaccine as well. And when you're under 15, you only need the 2 doses. But when you're over 15, that's when you should aim to have 3 doses of the vaccine.
Oh, Dr. Kwenin, during the break, you were mentioning there's some new WHO recommendations on cervical cancer screening. Could you please just give us a quick summary on that?
Yes, sure. So the WHO now they've done some studies and they've come up with different ways of screening for different demographic populations. So you can either go ahead and do your pap smear, which is what we know that we do routinely every 3 years, or you can have the HPV test first, actually. If the HPV test is positive, then you could then go ahead and have the pap smear done. In some societies, they're advocating for both, and in some societies, they're advocating for something called the VIO, whereby the cervix is visualized and painted with acetic acid to look for any abnormalities. If there is an abnormality, then treatment is offered at that point. Dr. Iwuji, I don't know if you want to add to that.
So for low-income settings, or is that done in urban? For me, I have a challenge with that VIO when you don't have any tissue taken away. But is it suitable, for example, for use in Lagos amongst urban women, or is it just for rural?
So I think it depends on what you're aiming for. So even if we're in the urban setting, if we're trying to do a mass screening on ladies we would struggle to get into our clinics, then it's quite useful to do it then, because then you get your answer straight away. You can say to the ladies, you're positive, you're negative, go on to a clinic because we've seen this abnormality. And women are more likely to follow through if they know why. So they'll say, okay, something has been seen that is wrong, that is concerning, then they'll go to the clinic. But if a lady comes into a Lakeshore Cancer Center or goes to see Dr. Kwenin and she wants to get a cervical screening, then in that situation, no, I think it's better to go for what we've discussed, which is doing the HPV testing, doing this pap smears as well, if that's appropriate, and then moving forward. So in a setting where someone has come to the clinic to actually get screened, then we should stick to the guidelines of HPV testing and pap smears. But if we are going out ourselves and doing outreaches, that's when I would go for the VOI more.
Now, going from the VOI, you said you can do it, you identify it, you know what needs to be done. What kind of treatment is available now? The thing about cervical cancer, it's total prevention is possible. It's one of these, quoted as being one of the sort of most revolutionary aspects of preventive care. Is that so what are the steps and how quickly and how much treatment is available?
Then we would often want to get a biopsy if that's required, and then you can actually take out the area of where the abnormal cells are themselves. So before it develops into a full-blown or extensive cancer that has spread anywhere, we actually have that opportunity from doing these tests, these smear tests, to catch the cancer at an early stage and remove just that localized area of abnormality. But if we find that by the time the lady comes to us, it's quite advanced and it's quite big and it's spread, then the kind of treatment we do would be more extensive. So we would want to get a CT scan, for example, or an MRI scan to look at the rest of the body and see how far the cancer has spread. If it's spread to other parts of the body, then we might want to do chemotherapy, for example. Or if it's not spread to other parts of the body, but it's just too large for us to take out with just those abnormal areas, then we might want to do surgery to remove the womb, for example. There's a hysterectomy is what it's called. And we might want to give chemotherapy or radiotherapy. So all those treatments are available here in Nigeria.
Okay, now I know that at Lakeshore there's a lot that is done. But is it, we talk so much about treatment. I know we're going to talk about breasts at the moment, because of course what makes a woman different from a man? Her womb, as in her genital area and her womb, and of course her breasts, which is what makes us special, which makes us different, able to carry children, etc. And those are the sort of challenging parts, and that's why we're looking at us as women today. Now, talking about breasts, what are the current guidelines in terms of breast screening? Dr. Kwenin, do you?
Yes, sure. Breast screening should start really from the age of 35. So in our clinic, we start screening women from the age of 35 upwards. At a younger age, we screen with ultrasound, breast ultrasound. The advice is that the gold standard should be mammogram from the age of 40 onwards. But I have to add a caveat to that. There are a lot of women who go for mammogram who are in their 40s, even 50s, that the mammogram will still advise because they have very glandular breast tissue to still have an ultrasound. So for in our clinic particularly, we actually offer women both. From the age of 35, they have just the ultrasound, but once they're 40, we actually advise them to do both, because oftentimes they go for the mammogram and they're still advised to still do an ultrasound because the mammogram will not pick up small abnormalities. And that's where the ultrasound comes in. So the two is used. And screening can be done. So mammogram is advised every 3 years, but some women literally come every year. Women who have family histories of breast cancer, if you find a lump, they come more frequently. And I mean, the radiation associated with mammography is very low. So that's also acceptable.
Now, Dr. Iwuji, I know you as an oncologist, you see a lot of patients. We've been told that it's very concerning that there's a lot of family clusters now. particularly in Nigeria, they're seeing a lot of family clusters of cancer. And a lot of women with first-degree relatives with cancer. And, I don't know how you are finding it as an oncologist. What do you think could be behind that? Do we need to start doing more genetic screening? Or is it, could it be the genetics? Could it be the environment? Why is it right now in a place like Nigeria, which didn't used to have all these cancers before, we're getting lots of cancers, but a lot of them being clustered in families? Dr. Iwuji.
Yeah, so that's an excellent question. I think it's a multifactorial situation. So I do believe that we need to do more genetic testing in Nigeria. And we do have genetic testing available. It's just a blood test. And there's some cancers that are linked together. So if you have someone else in your family, particularly a first-degree relative, so like your mother, your sister, or an aunt, for example, mother, sister, aunt, and you have that in your family, then you should go ahead and get your genetic screening done, this blood test. If you get breast cancer at a younger age, which is what we find in Nigeria a lot, so if you have ladies who have breast cancers in their 20s, their 30s, then certainly they should get the genetic screening test done as well. And the other thing is that in our society, we tend to get more of what we call triple negative breast cancer. So breast cancer can be driven by hormones, it can be driven by a particular protein called HER2, or it can be driven by neither of those two. So if it's not driven by hormones or by HER2, then we call it triple negative. And again, that is more common in our society. And that combined with our ladies who get it at a younger age means that they should get the genetic testing done because it's more likely to be genetically linked. Then on top of that, we have other things like environmental factors, pollution, the stress levels that we have here in general, our diet, our exercise, our looking after things like diabetes. All of those things contribute to the risk of getting not just breast cancers, but a lot of different cancers. And so when you have all of that combined, then those are some of the factors that are contributing to ladies and men as well getting cancers at earlier ages and more of these family clusters.
Yeah, I think that's so important because we're talking here now about causes and we're talking about what we can do. And this is why we're talking about this, this program, why we're focusing on women's health. What can we do? How can we mitigate some of those factors to ensure that, we reduce our risk of getting these cancers? Something that came up a lot last year was the fact that diesel from generators is now proven to be a cause of cancer. And, I wonder, because I know Nigeria before, Nigeria now, if this is not a cause of a huge amount of cancers, in our environment, because here we're living with diesel fumes on it. In fact, we don't even smell it anymore. A lot of us are so immune, you don't even smell, these fumes. And I know a lot of them are sort of microscopic, but before, you'd walk into a place, you'd notice a smell, and you could even move away from it. But now we're also, immune to it. We don't even notice it, and we're just inhaling all of these toxins, and it's affecting us. So, again, the importance of looking at things that, like even moving to solar. If when your generator breaks down and you're considering something else, I think these are some of the things we need to do. But looking at that aspect, what should women be focusing on this January? What should our goals be for the year in terms of how we can look after ourselves better?
I'll come in here. I think I agree with what's been said about increase in diseases, increase in cancers. We're seeing it a lot more. If you live abroad, you'll be offered screening from age 50, not age 35, like I mentioned. So we're in a very peculiar setting, as you said. There's a lot of pollution. I think probably there's some diet-related things as well. And I think right now, as the year starts, women should be looking towards living healthier, being more aware of their health, going for the screening. When I see patients, even if they're not due for screening, I'm a big advocate of self-awareness. So I teach women how to examine their breasts. So even if you're not due for your screening, you should be examining your breast regularly and know what feels normal so that when there's something abnormal, to go in and get checked. Some women find lumps and they ignore it, Sadly, some women ignore it, maybe out of fear, denial. They don't want bad news. And by the time they eventually come, there may be a big cancer there that has spread. And now you've moved from curative to now a palliative. So I really urge the listeners today to be more aware of their health. Make sure they see their doctor, trust their doctor for their screening. Screening can start as young, as we said, for cervical from 21, for breast from 30, 35, really. You need to eat healthy. We always talk about that as doctors. Healthy eating and exercise is extremely important. I think we'd see a lot less disease if we all ate what we should be eating, which is regular fruit and vegetables, because that's what contains the minerals and vitamins that help us repair our bodies. I have young kids, and they teach them in science about food groups, and I'm like, this is so important. You guys need to learn this, because we don't eat enough fruit and vegetables. We have them, we have abundance of fruit and vegetable in our society. We just don't eat them in the right proportions. We eat more carbs, less of the fruit, less of the fiber, less of the fruit and veg. So fruits and vegetables should be top of our diet list when we're making all our menus for our houses. We should include that a lot more. And of course, protein, because that's where we get the nutrition. That's where we get what helps us kill all these bad cells, because the cells start, but your body is actually designed to fight off bad cells if you give it the right nutrition. And of course, exercise, very, very important. Exercise is so key. It keeps your weight down, it keeps blood flowing, it keeps adrenaline flowing. All these things help us, actually. We don't realize, and you don't need to do a lot. A little exercise every day. I even tell people, even if you can do 10 minutes and you build it up, it's every day. It goes such a long way. So I think that's my message for people this year.
Thank you.
We wish all our listeners very good health.
Thank you very much. So do you have any last words for our listeners, Dr. Iwuji?
I do. First of all, I want to say that cancer is curable. It can be prevented and it can be cured. Everybody thinks that cancer is a death sentence, but the reason why so many people struggle with their cancers, particularly in Nigeria, is because we get to it at a late stage. So if we can just go ahead with the prevention, like we talked about the vaccine, we've talked about the screening, then that will make a huge impact. So 3 words I want to just give to our listeners. First of all would be, like Dr. Kwenin said, diet, exercise, screening. Those should be your resolutions. Diet, exercise, screening. That's it. Thank you. Thank you.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.